Hi, and welcome to the CAFMA Connect. I'm your host, Fire Chief Scott Freitag, and with me in this new year, Assistant Chief of Operations, John Feddema.
No, thank you. We were discussing it beforehand, Jonah and I'm guessing that you brought me in to kind of cool the ratings down a little bit. The podcast must have been getting a little bit too hot because I usually come in and help bring it down.
I think Tharp and I were able to bring the ratings down with our New Year's.
Oh, very nice.
Episode, which I thought was pretty good. I like the Hawaiian shirts, but it is the new year. We're just through January 1st, and of course, a lot of people across the country, across the world, make New Year's resolutions.
Indeed.
Do you do that? Do you partake?
I always know that I'm gonna fail within the first week, so I don't make too many resolutions.
Yeah, I do. Jonah, do you make New Year's resolutions? None. You know what? I don't typically, and yet I wrote something in the review last week, and it just said that I was going to choose to go into this year with a positive attitude, and that I would finish the year stronger than I started the year, which I try to do every year. So it's not really a resolution. I don't resolve it.
Sure.
Honestly, I think you know this. You have to get yourself motivated every day to keep up with just the day.
Sure.
But I do think March, April would be a great time to check out Marketplace and Craigslist for some used workout equipment.
Well, absolutely. And the other part of it is I don't want to join the crowd at the same time.
Right.
I think February resolution should be the new thing on like a Tuesday. I think that would be much more hip.
Any Tuesday in February.
Yeah, there you go.
I like that idea.
Yeah.
It's thinking outside the box.
Correct.
That's what we do here at CAFMA, John. We think outside the box.
Well, and going back to what you said before, the concept is obviously be better today than you were yesterday, better tomorrow than you are today. And that, it shouldn't depend on the time of year. And like you say, kind of using the whole year as an example, try to end it better. But that takes a mindset, that takes an approach to something that you have to want to do that.
Well, and think about it. It's new year, new me. Even the year itself couldn't do better than it did the year before.
Not typically.
No. And 2022, we will see what it brings. I think it's going to be good for us. We have a lot of good things, I believe. Some of them we don't know what opportunities are going to be out there and present themselves. We don't know what challenges lie ahead. Some of them we know. Mm-hmm. But I think the way we approach challenges here, typically we turn them into opportunity.
Sure.
So what those are going to be, I don't know yet.
Yeah. Like I say, there's going to be challenges.
Sure.
It's just the nature of it. Obviously, you look forward and you hope for better. You hope for an improvement, and obviously you got to be striving for that. But at the same time, there's going to be challenges, and we don't know what they look like. Nor do we want to know what they look like.
Right.
Because if we knew what they looked like, we might dread them more than what you can do to try to be hopeful that it's going to be better.
Yeah, the anticipation.
Yes.
That kills you. I'd rather just be surprised sometimes.
Surprise.
We did finish out the year strong last year. Let's talk first about the call volume. Significant.
Yes.
I did the figures last night, and I had to Google how to do the numbers because numbers aren't my thing. Finished the year at 17,814 calls. In 2016, by comparison, 12,800 calls. Yeah. So from 2016 through 2021, a 5-year span, 38.3% increase in call volume.
Yeah. Yep. No, and I think you look at just from last year to this year,
right?
The percent was around 15% increase. So
16.6.
That was close.
Yeah, you were close.
Yeah. So a lot of that increase came in just this last year.
Right.
But obviously over that 5-year span has been a significant increase in the call volume.
Yeah.
We can't always predict that that's the way it's going to continue to climb, but it certainly has not gone away. Call volume has not gone down, and it has followed the trend, month over month, and just that trend has continued to increase month over month.
Right. Well, and I think it's important for the public to understand, and even our folks to understand, we monitor those call volume and those statistics every month.
Sure.
So that we can plan for future needs,
yeah.
Additional people, additional stations. Yep. That all has to be taken into consideration. It's based off of that data that we collect.
Well, and not just the call volume. Mm-hmm. Call volume is obviously one of the things that we monitor. You look at the other things that we monitor includes unit hour utilization.
Yep.
How long are units committed during a 24-hour period in that percentage in that time that is available to them. And obviously not just calls. We have training. We have other responsibilities that they have, public education.
Right.
how often they're being utilized. Along with that, you have the reliability that goes along with how we spread out our units,
right,
and how we try to respond to those calls. Response time is the other one of them,
right.
And you see as the call volume increases, reliability goes down, response times go up, and decisions have to be made in the long term.
And I think right now we're not too bad
as
far as unit hour utilization. We're looking at that monthly. And our response times are still good.
Sure.
They're well within our established standards. We're beating the standard each month. But we do know, looking at the future and looking at the growth in the area, we're talking the next 5 years, we're going to need a new station and personnel. But as you and I have talked, we need to look at some additional people now just to help with our staffing needs. And typically we'd look at it from an overtime, financial standpoint of, hey, we're going to save more than we're spending in overtime, so we'll cut down our costs. And in this case, you and I are trying to look at it from the standpoint of, okay, we can help the overtime costs, reduce those some. But in reality, we're concerned about burnout of our folks.
Oh, absolutely.
And so we need to support them by bringing more people in.
Yeah, you look at all the other activities that go on that cause overtime and cause, the strain on personnel.
Right.
It includes training, includes a lot of different things. And, part of it is how do we keep a healthy response force?
Right. Well, and the other thing that we did right at the end of the year, the board approved this, and just so people know, we're going to say this up front because I was just at the county supervisors this week visiting with them about the ambulance transport issues that we face, and their concern was government spending and expanding government. So the board did approve the purchase of 3 brand new rescue units and 1 used unit pending the approval of the Northwest Fire District Board.
Yeah.
And as long as they approve it, then we will have 4 of our own units. Now, in order to make those purchases, we pushed off $800,000 worth of other items that we were going to purchase, capital items, trucks, brush truck, things like that. And to be honest, we couldn't get those anyways.
Sure.
Because of the shortages, global shortages of things.
Oh, yeah.
The manufacturers said, look, you can order whatever you want, but we're not going to get it for you.
Sure. Yeah.
Perfect. So we bought 3 units that are the brand new units. They were on the lot already, basically demos.
Yep.
We have a Ford F450, a Ford F550, and then a Ram. 2 of them are 4x4, which is good.
Yeah.
That's what we need. But I think this was a wise move by the organization. I really appreciate the board's support because we have a proven concept by running rescues.
Yeah, absolutely. And you look at, go back to the response times, call volume, all that stuff that's going up. These have been needed at this point to add capacity to the system.
Right.
And what we've been currently using through the help of Mesa and Northwest, those have been utilized. And again, those are just, different numbers that we have to track, but we have utilized those a number of times to help add capacity to a system that is currently strained on the ambulance side.
Right. Well, and if you look at it, just November, December, the rescues responded more than 200 times and transported 66. Now, why the disparity in the numbers? Because we're working a very narrow window of being able to operate these rescues. So we try to use or exercise quite a bit of caution as to when we transport and when we choose not to.
Yep.
However, if we were operating as an ambulance, then we would have transported 100% of those plus additional.
Correct. And you look at the challenge for the company officers and the battalion chiefs at this point is having to make those decisions.
Right.
Because like you say, they're bringing them 200 times and responding, transporting 80 times, or whatever we end up doing. They're having to make the decision when they go out the door right now, do we have a unit available?
Right.
How far away is that unit? Do we need to utilize our own, resources right now? It's not just going to the call and thinking like, okay, scene safety, I want to stabilize the patient, all that kind of stuff. They're having to think about those transport units as well.
Right.
They shouldn't have to. But they certainly are doing that right now, and they're doing a great job helping, again, add capacity now with a system that is strained with the whole purpose of patient care.
Patient care has to be the number one priority. And I know December 27th was a busy day. We transported 11 patients that day. One of them was at 2 o'clock in the morning, which is a quiet time in the area. Yep. But the closest AMR unit that could respond up here was coming from Skull Valley.
Yeah.
I know one of our folks talked with a crew yesterday or day before. They were in from Tullison. Yesterday there was a crew up, or no, it was several days ago. It was the day that it was icy last week. Mm-hmm. There was a crew up here from Pima County that didn't have the radio capabilities to be able to talk to our dispatch or our crews. They ended up getting stuck because the radio traffic that our crew, or the message our crew relayed, never made it to that ambulance crew.
Yeah.
And so while they got on scene, they got stuck, which delayed patient care again.
Yeah.
And that's a problem. We appreciate the crew being up here.
Oh, yeah.
But it's certainly problematic in the system when you can't communicate because you're sending units that have no ability to communicate and don't know the area.
When you look at, we worked really hard to get, years ago to get Lifeline, the ability and the capabilities, working with them in a partnership to get them the radio capabilities to get on our channels, which is a good thing. And you look at from PRCC how much they communicate with those AMR units on a regular basis. They're constantly communicating with them. Information from crew to crew is being shared. They switch over to the command channels. All that is very good. And like you say, it poses a challenge when they can't. And there's a gap in that communication. Even if the dispatch can relay it to them through their own dispatch, you're talking about a significant gap from just being able to tell them directly. Right. So we, like I say, we work very well with those crews when we can communicate with them.
Right.
The other challenge that we've seen too is the AVLs being able to see where they're at. Not that we're out there trying to manage where they go or how they stage their units, but it is helpful for us to be able to see where they're at and where they're responding from.
Right.
And again, part of the system. We are, when we don't see them because they're coming from out of the areas, we've noticed that some of those AVLs aren't communicating with the system. So even dispatch, who can help navigate some of that stuff, they're not able to see them sometimes.
Well, and we have the other issue with AMR, and we filed complaints with the state on this, and that is marking units on scene prior to their actual arrival. And this happened again this week, at least once that I know of, with Engine 540, and they reported. Fortunately, they have a screenshot of it, so we have the evidence once again to provide to the state that the unit was marked on scene 7 minutes prior to its actual arrival on scene. Why is that important? Because they self-report to the state saying that they're meeting the response time requirements in their CON. I would argue that they're not. Mm-hmm. The other side of that, not only do you have them putting units on scene prior to arrival, which skews the data, we posed a question to the state, Chief Naminsky did, hey, on these calls where AMR's dispatch, but they don't ever actually arrive or transport. So patient was transported by CAFMA rescue, by private vehicle, by in a private vehicle with paramedics and an engine. Are those counted against their response times? So those are calls they were dispatched to, but because they failed to perform. Yeah. Well, if you have them putting units on scene prior to arrival, double assigning units when they're not available, and you're not counting any of these times where they're supposed to be on a call and don't show up, all of that data is useless. And of course, it's self-reporting, so that's a problem. Yeah. And we finished the year. I wish I had a drum roll for this. Maybe Jonah can add it in later. But the number of times we were at level 0 from July 1st to December 31st was 760.
Mm-hmm. And the nice thing about that's not us calculating those numbers.
No.
That's coming from PRCC, who is, again, working directly with them to try to get those units on scene. They're the ones that are helping us calculate these numbers and providing this. We are then obviously taking those forward, which is an argument that something needs to change in this system right now. Go back to what you were talking about as far as not our units that transport not counting against it. Obviously, we are helping prevent catastrophic failure.
Yes.
And that failure is in the patient treatment. Those you pull those units out, and all of a sudden, it's going to be very clear that there's a problem. Obviously, we're not willing to do that because at the same time, patients will be suffering the consequences of that. But having those units in the system, it is imperfect, but it is helping them, AMR, prevent catastrophic failure right now.
Right. Yeah. If we didn't have these rescues, those 66 patients over the last 2 months, how long would they have waited? Sure. What would have happened to them had we not been able to transport? That's the problem. This is a health and safety issue. This is the well-being of our constituents.
Mm-hmm.
And it's important that we're providing them transport services, getting them to the hospital. And, as I said, I talked to the county supervisors this week.
Yep.
And ABC 15 did a story Tuesday night. They did 2 stories, one short one at 6, one longer one at 10. And what I found interesting was AMR's response to level 0 was it's not a big deal because it only lasts for seconds.
Yeah.
That is absolutely not true. In no way is it accurate. We have phone recordings or audio recordings from AMR dispatch calling PRCC saying, I don't have an ambulance for you for this call, this call, this call, or this call, and we'll let you know if something changes. That's not mere seconds.
No. And even if, like you say, even if there was a time frame where a unit then becomes available, you look at our area. Our area is not condensed. It's not condensed to the size of one city. You look at CAFMA's jurisdiction is 367 square miles. That's a big area. You may have a unit go available in Prescott Valley, but is responsible for responding to a call in Paulden.
Yes.
That time frame is going to be very extensive. And yes, the unit may be available, but where are they available from?
Right.
And our area is very large, and that's why we have our own units, strategically dispatched, throughout the whole area, and we even move engines on occasion if we have to help strategically place them.
The other thing that AMR said in that news story that I found interesting was we have units staged at the borders of the Quad City area, so there really is no delay. I think you and I both know that is not true. They do have a backup agreement with Mayor, and Mayor is getting pretty upset with them for how they're being utilized. But their backup, when they're out of the units in the system up here, is Wickenburg, it's Williams, it's coming from Phoenix. Now we know Tullison from Pima County. Yeah. They're trying to send units up here because they can't staff, yet they don't want us to operate.
Sure.
They don't want another private company up here, but they won't provide the services, and they just kind of say, hey, this isn't happening. Nuh-uh. That's your answer. Nuh-uh. It's like dealing with a little kid who's in the cookie jar with cookie all over their face, a cookie in hand, and the parent says, hey, what are you doing? Were you in that cookie jar? And the kid looks at him and says, no, while they're holding the cookie.
Sure.
That's what we're getting from AMR.
And I feel like they've doubled down on the concept that, no, there's not an issue. I think it's important. I mean, I know personally, I don't want to be in the ambulance business. Mm-hmm. What we want, though, is more units available in this area. And I think that's what, even sound like with the Board of Supervisors and the conversations, there is another company that's put in a CON. We'd love to have them up here. We'd love to have 3, 4. Bring as many units up here as reasonable.
As we can.
Obviously, as a governmental agency, it's different than a private agency as far as the money that is being trying to be made. But they obviously need a viable system to be in. At this point, I think there's plenty of capacity to throw in additional units, additional companies into the system to make it healthier.
Oh, absolutely it is. And as I pointed out to the county supervisors, one, CAFMA having a CON does not increase your taxes.
Sure. Because
under state law, it has to be revenue neutral. It has to be self-supporting. 2, we've supported the other private company coming up here. It's AMR who's fought against it.
Yes.
And I think that was important for the county supervisors to understand that it's not us trying to prevent another private company up here. It's them.
Yes.
And the state has been dragging that. That's on those folks.
Yeah. There's someone sitting at the edge of the boundaries ready to come in and support the system, but the state has not allowed that at this point.
No. And AMR has fought against it.
Sure.
So I think that's important for people to know out there that we've tried to work with them over the years. And they never really worked with us in earnest until Priority was coming up here. Sure. And I addressed the agreement again because someone on social media the other day said, one person said, Freitag's just driving this. I don't know exactly what you mean by Freitag's just driving this. The question is, do we have enough ambulances to transport patients who need it, or do we not? And the answer is, we do not.
Yes.
There's nothing for me to drive other than an educational campaign. And it's not even a campaign, but an educational opportunity to let the public know, because we've tried every other avenue.
Sure.
Now we need the public to help us.
And if nobody is aware of the issue, whether it's the public, whether it's elected officials, then no one is going to help provide solutions for us. This is a situation we've put units in the system, right?
Yes.
But we don't have full authority to fix this for ourselves. If we did, obviously we would have already done it. We don't. So we need support from the state, the governor. We need support from the public in order to get this done, because we don't have the basically authority to do this to the capacity that we need to support the system. So at this point, we need somebody, spearheading the challenge to say, no, people need to know that there's a problem right now.
And it is costing us money currently,
Yes.
because we can't charge for the services we're providing, but we can't leave people lying on a scene either. No. So it's a balance, and we need our local elected officials to step up, and a lot of them have, to say this is unacceptable for our community. State, you need to do something. And that's why we're working with the Arizona Fire Service to run a CON bill this year, legislative changes, to update a statute that was written in the 1980s by private companies to protect their interest.
Sure.
It's a big lift, because the private companies have a lot of money and lobbyists down there. And not all the private companies, one private company, maybe two, but AMR and a gentleman that operates out of the White Mountains. The others are like, no, we get it. We understand this needs to be updated. It's that statute that has allowed things to get where this is today. And so that needs to be updated as well.
Yeah.
That the ask is the same as it's been, which is, hey, call the governor and tell him that he needs to issue an emergency declaration to allow us to operate under temporary authority, because we can get personnel hired, we can get these units in service, and we can start providing the care that our constituents deserve.
Well, I think the other part is important to note. We've gone to a lot of the partner agencies to try to get support, if not all of them, but use even our medical direction in doing what we're doing right now to support what we're doing. This is not just going this alone. It is trying to get other people involved in the system who are part of this system, and that includes our medical control in helping develop how we are currently utilizing our resources.
Sure. Well, it was good this week in front of the county supervisors, because Chief Timorowski from Wickenburg says hi, by the way.
Thank you.
He came up to stand by my side and say, this is a problem. This is a serious problem, and it's impacting the folks in my area.
Oh, yeah.
And Sheriff Rhodes was sitting back there and supporting us as well. We've helped the Sheriff's Department file some complaints.
Sure.
And I didn't put him on the spot and ask him to speak, because I know he had been speaking with the county supervisors privately, individually. I didn't see a reason to put him on the spot publicly. But we're starting to see more people come out publicly and say, look, yes, this is a problem. He's not wrong. We do have a meeting this week down at the Capitol, and fortunately we have some folks from the hospital that are going with us.
Yes, yeah.
And I think that's important, because I told the county supervisors today, I said, under oath, the emergency room director for YRMC told the court in the hearing that for priority CON, that the emergency room physicians have lost faith in the current provider's ability to provide transport services for our constituents throughout the entire community. That's not me saying that.
Yes. Yeah. Yep. And I think that's important to note, because, like I say, it's not just our fight. This is not just affecting us. This is affecting other partner agencies, including outside of this area, as the units get drug in or are unavailable even to support the hospital in transfers of patients.
Right.
Again, it's not just us. And getting those folks out there in support, just in communication of, hey, no, we do support CAFMA. We do support some kind of change. Even if it's not us, we support a change.
Yes.
That there is a problem, that we can't just look at, take for face value that from AMR at this point that there is no problem. There's a problem. Operationally, they are failing right now, and they need to make a change.
Yeah. And, in Prescott Valley, because sometimes people think, well, this is happening in more rural areas of our jurisdiction. That's not true at all. As a matter of fact, on December 27th, of those 11 transports, 7 were in Prescott Valley, in the center of Prescott Valley.
Yep.
And some have said, well, your educational efforts are scaring the community. Well, we're not. The facts are scary. Our intention is not to scare the community, but spur them to action, a call to action. But the fact of the matter is, here's the truth, and the truth is not pleasant.
Yes.
And I'm sorry if the facts are inconvenient.
Yeah. And if we don't do this, you look at our own units and how much they will be committed to a scene. If they're sitting there waiting for a unit that is 45 minutes an hour,
sure,
you're committing them, and that unit hour utilization, as our call volume goes up, we are going to be forced in situations where we don't have a unit to respond. And it is a chain reaction that obviously the burden to transport is on AMR at this point.
Right.
But we're here to support. And I think at this point, they need more support in the system to help get patients to the hospital.
They do. They know it. And I know our regional manager from up here, he's been deployed quite a bit with AMR under federal contract to support areas that are having issues with ambulance response. It's interesting to me that you will pull the regional manager from an area that is not getting transport services and send them under federal contract somewhere else to ensure a community on somewhere in the country is getting services.
Yeah.
Why not provide services here then?
Yeah.
I don't understand it. So we're going to keep working on that issue this year. We're going to keep pressing it. We're going to keep countering the narrative that some are trying to create. This is not an expansion of government. This is not an increase in taxpayer monies. One, we have an issue that I think we've clearly shown there is a significant issue in the area. We need a solution, and we know that us providing some level of ambulance transport in the 911 system, one, will not increase the tax rate, and two, will provide better services to our community. So there are some who dispute that, but those are the facts. And if they have questions, they're always welcome to come talk to us.
Sure.
That's the funny thing is we hear things in the community from different places, and it's like, well, why don't you come just sit down with us and ask a question instead of making stuff up?
Yeah. When you look at some of the criticism is that we're trying to expand government. And obviously we're not doing this for any expansion other than we see a need.
Yes.
And the other part of it is we are not doing this for profit. It's not for money.
No.
So if you want to claim that we're doing this for ego, you can certainly throw it out there. But what we're trying to do is satisfy a problem, and that's it.
And I think you and I agree that the government shouldn't expand every time there is an issue.
Yep.
However, there are certain things that the government is responsible for.
Sure.
That is road infrastructure, it's education, and it's emergency services, law enforcement, fire, and medical services. That's what government should be doing. Now we can debate the rest of the stuff government gets into, but this is one of the areas that is our responsibility. And if you look across the country, a majority of these models are fire-based EMS, and they work far better than you see with a private company. Personally, I think an interdependent relationship between a private and a governmental agency would provide excellent services to our area. So we're in no way trying to push private companies out. We're not trying to do interfacility transport. Supplement the 911 system. That's what we need. But I think there's opportunity this year. We're doing well with our substantive review on the CON, so that's good. We're pushing that. If we are successful, there's going to be opportunities for people who are looking for jobs to be hired by us. We're going to be able to bill and pay for those services. And provide much better for our community. At the same time, we're looking at the SAFER grant to see if we can't bring at least 5 additional personnel to your side. I think we have some great training lined up for the year already. Coming up, I know we've got the Chief Executive Officer program in February through the Arizona Fire Chiefs. I'm excited about that and nervous about that at the same time because I still have to get all that together, which is part of my job today.
Nice.
Is finalizing those things. But I know CARTA has a lot of stuff planned for this year. I just think that we're gonna continue to challenge the ambulance transport issue. You're gonna continue to hear us talk about this on the podcast because it's important that we get the information out. But we're gonna talk about all the good stuff.
Sure. There's a lot of good things going on.
So with that, John, anything else for 2022?
Not a bit.
Jonah, anything you'd like to add?
I'm good.
All right, perfect. Well, thank you to everyone. We look forward to this upcoming year, and until next week, try not to get in trouble.